Potassium is an essential mineral that plays a critical role in various bodily functions, including nerve function, muscle contractions, and maintaining a healthy heart rhythm. When the levels of potassium in our body drop below normal, it can lead to a condition called hypokalemia. Severe hypokalemia can be life-threatening and requires prompt medical attention. In this video, we will discuss the 10 common signs of low potassium, and we will also discuss methods of treating low potassium and preventing its occurrence in the future, so stay tuned till the end. Number 1. High blood pressure. Potassium and sodium work in tandem to regulate blood pressure. While sodium promotes fluid retention and increases blood pressure, potassium helps counterbalance its effects by promoting the excretion of sodium and excess fluid, thereby aiding in the maintenance of healthy blood vessel function. When potassium levels are low, it can disrupt this delicate balance, resulting in increased sodium retention and fluid buildup. The increased fluid volume puts added strain on the blood vessels, leading to elevated blood pressure levels. Chronic low potassium levels can contribute to persistent hypertension, which increases the risk of cardiovascular diseases such as heart attack, stroke, and heart failure. It is important to note that low potassium is just one of several factors that can influence blood pressure, and comprehensive management of hypertension may involve addressing other lifestyle factors and underlying medical conditions. Number 2. Increased urination. Potassium levels and kidney function are closely linked. The kidneys play a crucial role in maintaining the body's potassium balance by filtering excess potassium and excreting it through urine. When potassium levels drop, the kidneys may excrete more potassium to restore balance, resulting in increased urine output and more frequent urination. Individuals with low potassium levels may find themselves urinating more frequently, including waking up at night for bathroom visits. Excessive urination can contribute to dehydration, electrolyte imbalance, and loss of other essential minerals. Increased urination, especially when accompanied by other signs of low potassium, should be evaluated by a healthcare professional to determine the underlying cause and appropriate management. Number 3. Muscle weakness. Muscle weakness is another common and noticeable sign of low potassium. Potassium is a critical mineral for the proper functioning of skeletal muscles. With insufficient potassium levels, an individual's muscle cells can no longer transmit sufficient signals between nerve cells and muscle fibers. This can also disrupt the transmission of signals within the motor neurons themselves, leading to weakness and reduced speed and accuracy of movements. Low potassium interferes with the muscle's ability to produce sufficiently strong contractions. As a result, individuals experiencing low potassium may also have trouble standing up from a seated position, climbing stairs, or carrying heavy loads. Severe potassium deficiency can pose a more significant threat to the respiratory muscles that are crucial for breathing, leading to respiratory distress. Before we proceed to the next surprising sign, be sure to hit the subscribe button. Number 4. Fatigue and lethargy. Low potassium levels can contribute to increased feelings of fatigue and lethargy. Potassium is involved in the process of cellular energy production. Alongside other micronutrients, potassium supports glucose metabolism, helping to convert glucose into ATP, the body's main source of cellular energy. When potassium levels are insufficient, energy production is compromised, leading to persistent tiredness, lack of motivation, and loss of productivity throughout the day. In addition to ATP production, the drop in potassium can affect the thyroid gland's activities, leading to lower basal metabolic rates. The body's metabolic rate determines how efficiently it burns calories for energy, creating a further sense of fatigue. Other factors that can exacerbate fatigue and lethargy due to low potassium include reduced oxygenation of the tissues and buildup of waste products in the muscles. Number 5. Muscle cramps and spasms. Potassium is necessary for maintaining the balance of fluids and electrolytes within muscle cells. When potassium levels are low, this balance is disrupted, leading to involuntary muscle contractions known as muscle cramps and spasms. Although the exact cause of muscle cramps and spasms is unknown, dehydration, overuse, injury, and low electrolyte levels may contribute to their occurrence. Muscle cramps can happen suddenly in any body part, including the legs, arms, and abdominal muscles. They may last a few seconds or minutes, and the intensity and frequency may vary. In contrast, muscle spasms are more prolonged involuntary muscle contractions that can affect different muscle groups. The common muscles that often go into spasm due to hypokalemia include the legs' hamstrings, the knees' back, popliteus muscle, and the muscles in the jaw or neck. Spasms can cause excruciating pain, reduce coordination, and a sense of weakness. Number 6. Tingling and numbness. Potassium plays a crucial role in maintaining proper nerve function. Adequate potassium levels ensure that nerve cells transmit signals effectively, allowing for the normal sensation and movement of the body. In the case of low potassium, known as hypokalemia, nerve cells may become hyperexcitable, leading to abnormal sensations like tingling or numbness. These sensations, known as paresthesia, can be experienced in various body parts, but are commonly felt in the hands, feet, fingers, or toes. Individuals may describe it as a pins and needles feeling, a prickling sensation, or a loss of sensation altogether. Hypokalemia-induced paresthesia can be temporary and resolved once potassium levels are normalized. However, persistent or severe tingling and numbness may indicate underlying nerve damage or other medical conditions, and it is important to seek medical attention for proper evaluation. Number 7. Digestive issues. Low potassium levels can impact the digestive system and lead to various gastrointestinal symptoms. Potassium is necessary for maintaining proper muscle function throughout the digestive tract, facilitating the movement of food, and supporting efficient digestion. When potassium levels drop, it can disrupt the muscular contractions responsible for propelling food through the digestive system. Our common digestive issue associated with low potassium is constipation. Insufficient levels of potassium can lead to slower peristalsis, the muscular contractions that move stools through the intestines. This can result in difficult or infrequent bowel movements. Additionally, low potassium levels can affect the smooth muscles of the intestines, leading to abdominal bloating, discomfort, and cramping. Number 8. Abnormal heart rhythm. Potassium is vital for maintaining a stable heart rhythm. The heart relies on electrolytes, such as potassium, to maintain the delicate balance that regulates heart rate. When the level of potassium is low, the deficit can lead to irregular heartbeats or heart arrhythmia. Symptoms of abnormal heart rhythm can vary from mild to severe, with some patients experiencing palpitations or a faster heart rate, while others may not have any symptoms at all. In the case of severe or long-term hypokalemia, low potassium can increase the risk of developing ventricular arrhythmias, leading to life-threatening conditions such as ventricular tachycardia, ventricular fibrillation, or sudden cardiac arrest. Low potassium can also contribute to the development of atrial fibrillation and flutter, creating an increased risk of stroke or embolic events. Number 9. Mood changes. Potassium plays a crucial role in regulating mood and emotions. Potassium is involved in nerve cell communication, including those responsible for mood regulation. Inadequate levels of potassium can affect the nervous system's function, including emotional processing and regulation, contributing to mood changes. Individuals with low potassium levels might experience mood swings, irritability, depression, or anxiety. In severe cases, hypokalemia can cause significant cognitive disturbances, including confusion, delirium, or psychosis. Mood changes related to low potassium can be due to several factors, including disruption of the blood-brain barrier, altered neurotransmitter release, and oxidative stress. Number 10. Weak bones. Potassium helps regulate the body's acid-base balance by promoting the excretion of acid from the body, reducing acidosis, and reducing the loss of calcium from bones. Low potassium levels can, therefore, lead to increased acidity and a higher calcium loss rate, contributing to the development of weak bones or osteoporosis. Patients with long-term hypokalemia might have a higher risk of bone fractures, even without additional risk factors. At the same time, low potassium levels can also disrupt vitamin D synthesis, further compromising bone density. It's essential to maintain healthy potassium levels along with other bone-healthy nutrients such as calcium, magnesium, and vitamin D through proper dietary choices and lifestyle habits. Treatment for potassium deficiency. Potassium deficiency can be treated by incorporating foods rich in potassium into your diet, such as bananas, avocados, spinach, sweet potatoes, yogurt, and fish. In severe cases, oral potassium supplements may be prescribed. To prevent potassium deficiency, it's crucial to maintain a well-balanced diet, including a variety of fruits and vegetables, and staying hydrated. Additionally, reducing the intake of processed foods, sodium, and alcohol can help maintain normal potassium levels. Regular blood tests can also help identify and monitor low potassium. Thank you for watching, and make sure to watch more amazing videos from our channel.